Hello everyone. Welcome to the high yield session for INICT 2021. And I think this is going to be a very important and high yielding session. I hope my audio video is clear. Please, can you give me a thumbs up if all is well so that I can start with? And hope you people are ready with your preparation too. We will be having a two-way interaction as I always have with you, because around the year we keep on teaching and you people keep on studying, but this is the time where two-way interaction is important and you really need to know that how much is your preparation. I think that will be a good simulation just before the examination. And many of the students were also asking that why did I kept it like very close to the exam. So I know you people are busy in your preparation and maybe feeling that it's very close, but take my words, I have kept it deliberately very close to the examination, because as I always get so many complaints about ophthalmology, that it's very volatile and very technical. So you keep tend to keep on forgetting and keep on getting these things that you are not able to recall. They are difficult ones or the volatile ones. So I thought, why not keeping it just before the examination, so that it is there in your mind on the day of examination, and you need not to recall these things. So that will save your time also. And when you will be getting a similar kind of a question, I'll wish that you get these kind of things in your examination. You will remember this session there. Okay. All right. So yes, so it's good to go. So good evening everyone. Sai, Anjali, Superman, Misha, Ritvik. See, what we are going to do, I'm not keeping it just a theory, because that becomes very boring, and that we have already taught you around the year. So guys, please check now. There was some little technical error, I think. Is it good to go? And please keep on posting your doubts also, because I'm there to take your doubts today. And that is the beauty of this session, and that is why I'm taking it live, so that I can answer the queries also. I was telling you that I have taken pretty important topics for the INICET, and I have tried to frame the questions on that, so that I am able to give you those important high yield topics in the form of questions, right? So is it good to go? Yes? Okay. So Superman, you are really a Superman to answer me. Thank you. Okay. So first you will have to answer me, and then I will tell you, and I will be telling you the other things also that could be asked around this question. So this question says that you have a girl, 15-year-old girl is there, who is presenting with a vision which is very less, 20 by 30. And she's having this in the left eye. The CT scan is showing an abnormality. What is the unlikely finding about it? So first of all, I would like to zoom this. Can you tell me what is this? First of all, we will start with this CT scan, because nowadays they are asking you more integrated questions. They are also asking you more clinical case scenarios. So this is again a perfect amalgamation, a question which contains ophthalmology also, radiology also, and your systemic also. So this is a hint for you. Now, first of all, coming to the radiology aspect. So can you tell me what is this? Let me see if you can answer, and then I'll try to. Yes, we will be talking about that also. So 10 seconds. Can you tell me what is this? They are asking you. This is a girl who is presenting with a visual acuity of 20 by 30 in her left eye, and in the left eye only she is having some abnormality. Can you see? This is the CT scan. Anjali, see clearly. You should be able to identify, is it a muscle belly enlargement or is it something else? See, whenever you are looking at the cone, okay, you have to remember that it could be the optic nerve also. It could be optic nerve or it could be extraocular muscle. So how will you see? Is it the enlargement of a nerve or is it the muscle? Please take care. See this. Schwannoma. Can you tell me what is the type of enlargement that you can see here? What is the type of enlargement? So is it a nerve or is it a muscle, first of all? And whatever it is, what kind of enlargement you are having. So I was saying that whenever you are looking at these kind of things, first of all, what should be your approach? Always see whether it's a nerve or it's a muscle. Now, if it is a muscle, you have to see whether it is involving just the belly or it is also involving the tendons. Okay? Because what is there in our mind? See, whenever we are talking of an adult and you are looking about the extraocular muscles, you are thinking about the proptosis. And whenever I am thinking about proptosis, especially in the adults, I am always thinking about the thyroid eye disease. And we know about the Coca-Cola bottle sign in the thyroid eye disease, where you have the bearing of the tendons. Jaipur mein bhi it's raining, it's raining everywhere. It's raining everywhere, hai na? So now this is not a muscle. Can you see? If you look here, this is the enlargement that you are getting in this area. This area we are having the enlargement. So this is actually the enlargement of optic nerve. This is the enlargement of optic nerve. Okay, not the muscles. Now, what kind of enlargement is this? This enlargement is called as fusiform. This enlargement is called as the fusiform enlargement. So fusiform enlargement of the optic nerve you are getting where? So many of you have given the right answer, yes. So I am thinking about the optic gliomas. Okay? So now once you have made this diagnosis, optic gliomas, which is also responsible for causing the proptosis, it's causing the axial proptosis. The kind of proptosis is also important. And the age group is also important. It's causing in children. Now, this optic glioma can be presenting separately also, and it could be as a part of some systemic disease. Now, the second question is, what is that systemic disease with which this optic glioma is associated, where it is found? Can you tell me now? Yes. Very good. It is the fusiform enlargement, and fusiform enlargement where you are getting the optic gliomas, like they can be independent optic gliomas, but there is a disease where we are getting this. So can you tell me that syndrome where you are getting the association of the optic gliomas, which are very, very common? Anybody? Yes? Very good, Pooja. Awesome. So it is actually neurofibromatosis, right? Now you have to answer with respect to this. So question number 1, option number 1 says pigmented iris lesions. Can you have pigmented iris lesions in cases of optic gliomas which are associated with neurofibromatosis? Yes. And what are they called as? They are called as the Lisch nodules. These are called as the Lisch nodules. And what are these Lisch nodules? These are actually the iris hamartomas. These are actually the iris hamartomas. I will show you the picture also. Lisch nodules are the iris hamartomas. A brother with the same problem. So they are asking you, what is the unlikely finding? So yes, we can have the pigmented iris lesions called as the Lisch nodules. That is likely. Now, can you tell me about the B option? Can I have this girl's brother having the same problem? Yes or no? Yes. Very good. Neurofibromatosis and Lisch nodules, tak everybody is knowing. Now, can you tell me that can her brother be having the same problem? Yes or no? Yes. So, is the option number B true or not? So neurofibromatosis is a autosomal dominant condition. So yes, we can have her brother also having the same problem, and she can also have this pigmented iris lesions. Okay? Now, coming to option number C, can she have a good vision after the surgical resection of the lesion? What is a lesion? Lesion is a optic nerve tumor. So if I am resecting this tumor, can she have good vision? Yes or no? And option number D is propensity to develop the CNS tumor. So can this person who is having the neurofibromatosis, can she have the CNS tumors? And can she have good vision after the resection? Now, optic nerve is the main nerve responsible for the what? For the vision. So if I am having the enlargement of this optic nerve, which is found as a fusiform enlargement leading to the axial proptosis, so I will have to resect this. So once I am resecting this optic nerve, can I get good vision? No. So this is wrong. But yes, this person can have the CNS tumors. This is quite common. So what is my answer? Answer is a good resection. My answer will be a good vision after the surgical resection of the lesion is not possible. So you should know about the optic glioma radiology. You should know its systemic association, and you should also know about the management options. So lot of things which are actually integrating with it are required to solve this question. Now, some of the important things that you should know with respect to the optic gliomas. So if you look at this picture again, you can see we have got lot of enlargement. This is again a fusiform enlargement of the optic nerve, and they are quite common in the children. What is the age group? They are usually common between 4 to 8 years. Now, though in the question they have given 15 years, but the most common age group is 4 to 8 years. And how many cases, how much percentage is found to be associated with the neurofibromatosis? It is 30%. Up to 30% of the patients who are having the neurofibromatosis can be having this optic gliomas, right? Then it's a benign tumor in the children. Mostly it is aggressive in the adult. So you can remember A for A and B for bacche. B for benign and B for baccho means baccho means it's benign, and A for aggressive and A for adults. It's aggressive in the adults, but it's a slow growing and usually non-aggressive because it's more common in the children, and children is a baccha. Baccho means it's benign, and it is showing the enlargement of the optic nerve. Now, many a times you get confused this optic glioma with another tumor, which is very, very common. See this. This is your optic meningioma. Can you tell me this? What is this finding? What kind of enlargement we get in meningiomas? Because this is the most common problem that we have. Yes, this is the most common problem that we have in the examination, where you are confusing whether it's a optic glioma or it's a optic meningioma. So in the optic glioma, you get the fusiform enlargement. What is the type of enlargement you are getting in meningiomas? Anybody? What is that sign called as? What is that called as? Yes, that is called as the tram track appearance. This is called as the tram track appearance. So when you are getting the fusiform enlargement, remember about the optic nerve. When you are getting this tram track appearance, the rail track appearance, parallel tracks, two parallel tracks, then that is your meningiomas. Now, of course, this is not the only thing which is different between the two, but this is a very important thing. And that is the important thing, that whenever you are getting an image, you are getting some, imaging pic. So always look at that. That will give you a very significant clue, and then your mind knows the direction where to think. So that will save your time also. Otherwise, you will start thinking about so many things. So if you know already that it's related to meningiomas, your definite direction will be there. So this is occurring more in the middle-aged females, and we have a characteristic railroad track appearance. Very, very important. Then I told you that I will also show you the pigmented iris lesions. See this. So you are definitely going to get these pigmented iris lesions also. And these are actually the hematomas. These are the hematomas which are found in the iris, called as the iris hematomas, which are also called as the Lisch nodules. So is it clear, guys? This is clear. And I'm going to give you certain important tips about the proptosis, because I feel that proptosis is a very, very important topic and very frequently asked. Last time, NEET 2020, there were 3 questions related to proptosis. So my gut feeling, it's important. So let us see certain important things about the proptosis, and you will also have to answer little questions too. See, first of all, the typical kind of proptosis and the typical pictures also we will be discussing. See, whenever I am talking about the proptosis and you have a question related to the proptosis, always see whether it's unilateral or bilateral. Now, once you have seen that whether it's unilateral and bilateral, that will help you like anything, because certain cases are presenting as unilateral only and certain are presenting as bilateral only. So if you are getting unilateral proptosis, you have actually, ruled out all the bilateral cases of proptosis, causes of proptosis. And if you are getting the bilateral proptosis, you have ruled out all the unilateral cases of proptosis. ठीक है? फिर देखना है कि whether it's acute, intermittent, pulsatile proptosis. If you remember, I told you about the PCB, P for pulsatile proptosis, C for chemosis, and B for brew was there. That was noisiness in the head. So this session, yes, I'll save this session for afterwards also, and definitely go through this session. You will get very many high yielding points here. So this is found in the keratoconcavernosus fistula. ठीक है ना? Then we can have axial and non-axial. So whenever you are getting a question on proptosis, always focus on unilateral, bilateral, axial, non-axial, acute, intermittent, pulsatile, all these things you have to see. Now see, it's a quick list for the unilateral proptosis. Now if you are getting unilateral along with congenital, then always think about the DT. So this is your CDT. CDT means you have got C for congenital, D for dermoid, and T for teratoma. So if you are having unilateral congenital, think about 2 things. Okay? Then you have got the trauma. Now trauma may obviously trauma say hemorrhage, you can have trauma say intraocular foreign body and emphysema. You can have these things. Now you can also have vascular. I'll come to inflammation, I know. Vascular may V for vascular, V for varix ho gaya, venous enlargement. Cyst, very unfrequently asked. Tumors, of course, you can have ES. And the thing which is most frequently asked is the inflammation. Now, inflammation may start with the orbital cellulitis. Be very, very cautious here. Start with the orbital cellulitis and go up to orbital mucormycosis, because at your level now, especially in the COVID-19 era, where you are having the mucormycosis spreading like anything, especially in those patients who are immunocompromised. So if you are getting a orbital cellulitis kind of a picture in a patient who is immunocompromised, COVID-19 patient, diabetic patient, diabetic ketoacidosis, having some malignancy, especially the blood malignancy, or having some kind of immunosuppressants, or maybe hemochromatosis, organ transplant history, anything like that, then always think about orbital mucormycosis, because the initial symptoms are so non-specific, you are not able to identify. So keep high index of suspicion in your mind that if I am getting orbital cellulitis and an immunocompromised state, I have to think about orbital mucormycosis. So it could be anything starting from cellulitis, abscess, cavernous sinus thrombosis, pseudo tumors, or it could be even tuberculosis. But yes, the 2 things which are very frequently asked is your thyroid eye disease, orbital cellulitis, and orbital cellulitis now, which is going to be asked even recently in the FMG paper also. The question that I discussed just one day before, that was my own framed question, and that came ditto next day. I do not know how they asked the ditto question, but they asked a question on orbital mucormycosis. So definitely a high index of suspicion you have to keep that in mind. Now, if I keep the bilateral proptosis, so bilateral proptosis may, if you have a child, rickets, you can easily know, and endocrinal may, thyroid eye disease, you can easily know. The important thing is your tumors. So please beware of your tumors, the tumors that can cause the bilateral proptosis. Again, very, very important. You have got three. We have got the lymphomas or the leukemias, Ewing sarcoma, and neuroblastoma. Now, these are again the things which you are studying in the other systems also. So, integrated questions, they can give you a typical picture, typical feature, the age group, the gender, and they can be asking you about the proptosis. So, again, very, very important. Okay? Now, there are certain scenarios. See this. This is your lymphoma. Lymphoma leading to bilateral proptosis. And a very important and interesting image, see this, the craniostenosis. So you are definitely, going to get these questions in the form of integration, and you can have these kind of questions where they can be starting with the orthopedics, and they may be landing up in ophthalmology, they may be starting with the medicine, they may be starting with the tumors, and they are landing up in ophthalmology, or they are starting with the proptosis and they are asking you something in the systemic disease. So keep those things in the mind, right? Then you have the acute proptosis. Whenever you are having a scenario where you are having the development of proptosis in a very, very acute setting, so always think about those things which are related to trauma. It could be emphysema, it could be a fracture, it could be a hemorrhage, even it could be a rupture of the mucoceles. Mucoceles are definitely very fragile, and whenever you are having the acute setting proptosis, we can have the rupture. Okay, so always take care of that. Then a very, very typical thing is the intermittent. Intermittent are always vascular, and vascular is varix. So if you will remember it like that way, I think diagnosis making will become easier for you, because see, there can be other causes also, but I always say 80-20 principle. So 80% of the time they are asking just 20% of the thing. So most probably when they are asking you about the intermittent proptosis, they are asking you about the varix. So that is the first thing. Okay. Pulsatile proptosis ke liye always remember PCB. Pulsatile proptosis, these are just the last minute high yielding points. Pulsatile proptosis mein remember the keratoconcavenous fistula. Intermittent में remember the varix, ठीक है ना, acute में trauma, and axial. Now axial thyroid eye disease is the most common proptosis. There you are getting the axial. Rest optic glioma में भी you are getting axial. So most of the places which we are studying are axial, but some are non-axial, that will be leading to a particular direction. Like if I have the lacrimal gland enlargement, or you have some mass here, so obviously it cannot lead to axial. So I think common sense will work there. So you can have that. All right. Now, one more thing I wanted to show you. See these pictures. Now, sometimes they are asking you just other subject question, and they are just landing up in ophthalmology in just of the in terms of the proptosis. So in that case, you should know how to identify the pictures. You can have the frontal mucoceles here, like you are having here, and then you can also have the lacrimal gland tumors. So be very, very careful when you are looking at the pictures, right? Then another important thing which I want you to answer is this. Yes. So these are again the quick revisions, and you can get similar kind of settings. And if you know these, cheat codes, then it will be a very, very, easy thing, a cakewalk for you to diagnose this. And maybe sometimes you will not require the options also. So this is your question number 1. Question number 1 is that if the person is having lid edema along with the sinus pathology, with the restricted motility, pain is there, tenderness, lid में trauma is there, fever is also there, then what are you thinking? Can you tell me what will be the diagnosis? Question number 1 is this. Then we will come to option number 2. So I have hide the answers here so that you can have that excitement of answering. If I'm having a lid edema with the sinus disease, with the restricted motility, tenderness is also there, fever is also there, lid trauma is also there. So what can it be? On the other hand, I have a person who is a young child or an adult. It's a slow growing orbital lesion. There is no much inflammation and it's near the bone. So what it could be? What it could be? So can you answer this? Anybody who can answer this? Try to answer. On one side, I'm having the lymphedema with the sinus disease, with the restricted motility is also there, pain is also there, tenderness is also there. So what is this? This is actually the orbital cellulitis. If you are having the orbital cellulitis, you are having inflammation all around, you are having lymphedema also, you are having ophthalmoplegia also, the pain and tenderness is also there, fever is also there. So you have all these things, and I think this is the most common scenario that you are getting in your questions when they are related to the proptosis. Well, on the other hand, if you have little or no inflammation and it's found in the young child or the adults and it's located near the bone, a very common is the dermoid cyst. And dermoid cyst is the most common cause of unilateral proptosis in children. So always think about the common things first. So if you are having a unilateral slow growing cyst like thing near the bones, always think about. Very good. Oh my god, Deepti is awesome. Very good. Anshad and Deepti, both of you have given the right answer. So yes, so we have this. See, I have kept the pictures opposite so that you can confuse. So this is a picture of orbital cellulitis here, and this is the picture of the dermoid cyst here, right? All right. So let's see the other one. We have a child here. Child is just 5 years and he's having the upper nasal quadrant mass. It's painful also. We have few episodes of proptosis, and I think I have told you this many times that what will be the answer if it is worsened by the respiratory tract infection. If it is worsened by the RTI, and even the MRI is showing the fluid levels. So a child 5 years, upper nasal quadrant mass is there. It's painful also. We have few episodes of proptosis. It is worsened by the respiratory tract infection, and MRI is showing the fluid levels. This is your question number 3. And the question number 4 says that a child is 7 to 8 years old. We have epistaxis, nose bleeding hair, bluish color lids hair, unilateral hair, and there is a lymph node enlargement. Lymph node involvement है, painful है. So what should be the answer? Can you answer question number 3 and question number 4? I think means you should have that kind of inclination that as soon as you see, oh, it is worsening by respiratory tract infection, it is in the child. So answer should be like this. Or if, oh, okay, it's a child and we are having epistaxis and we also have pain, we have lymph node enlargement, we have involvement. So answer should be like that. So what is the answer here? Okay, anybody else who can answer this? So yes, you people are correct. This is lymphangioma. Whenever it is worsened by the respiratory tract infection, it is actually the lymphangiomas. And when you have the nose bleeds, you have lymph node enlargement, you have pain. So rhabdomyosarcoma is a tumor actually, but the involvement is very much similar to the inflammatory condition. So whenever you are having the rhabdomyosarcoma, you will have a child, and because it's invasive, so nasal bleeding can be there, and along with this we have lymph node involvement. But then pain should not be there with the tumors, but this is one where you have also pain, right? So this is your rhabdomyosarcoma and the lymphangiomas images also, right?